We good? This has already started that one. So we're just about to get started. Just had some technical support in here to make sure everything's working. It looks like it is. Hopefully you can see me as well as the slides. And really fun. We have a whole bunch of new people joining us for this webinar, which is exciting. And those of you who have met with me know that this is far and away my most favorite operation. So I'm excited to talk about this this evening. I do have the ability to see questions. If someone raises a hand or puts in a question, I'll try to stay on top of the questions. And Ashley's in a room next door, so if she notices them, she can bring them into me, and I'll try to answer questions as they come up. That's sometimes easier than waiting to the end. We're just going to wait one more minute. My clock says 5:59, so in 1 minute we'll get started and go through the details of abdominoplasty. Okay, 6 o'clock, let's do it. So as I said, abdominoplasty is my favorite operation, and it has been for a long time. I think it restores contour, but it also really restores function. I've had 3 kids. I know what happens to abdomens after all the things that happen in life, and it's just a way to kind of restore your original contour as well as your original strength. It helps out with that as well. For those of you who don't know me, I'm a board certified plastic surgeon. I have been in the state of Maine since 2006. Prior to that, I was on the faculty at Columbia University in New York City, and we relocated here for a lot of different reasons. But I do have a lot of family in Maine and was happy to get back here. It's hard to believe that that was that many years ago. I went to medical school in New York City, then trained in Pittsburgh, and then went back to New York for my first job before moving here. But we're well settled here in Maine, and this is the time of year. I'm looking outside right now. This is it's finally becoming summertime in Maine, the best part of Maine. So let's start talking about abdominoplasty. So first of all, we're going to go through what it is, what the surgery, what the abdominoplastic surgery can do and what it can't do, who are the people that are good candidates for surgery, what you may expect with the consultation if it's with me or another plastic surgeon, things that you want to ask and consider when you're thinking about the surgery. I'll fill you in on what the risks are that are associated with the surgery, as well as safety concerns, what the procedure looks like, what the recovery looks like, and what you can expect for results. Anyone who attends this webinar this evening is welcome to schedule a free consultation with me to talk about this topic and any other topic. Just let Ashley know when you schedule, or anyone who answers the phone, just that you are on the webinar, and we'd be happy to have you come in and teach you more about it. So, and at the end, if I don't get through questions during the presentation, I'll definitely address questions at the end. So that's the plan for this evening. So what is an abdominoplasty? A tummy tuck is the other name for an abdominoplasty, but basically the idea is to get rid of all the skin and fat from the abdomen that's either been stretched out or weakened from changes in weight, from aging, from pregnancies, prior surgeries. Sometimes it could be from an old appendectomy scar. Sometimes it's from an old C-section scar that creates contour abnormalities. There's a lot of different things that can make people unhappy with the contour of their abdomens. A tummy tuck is not it's not a way for people to lose weight. It's not a substitute for a healthy diet and a good exercise program. It simply removes any of the excess laxity in the skin and soft tissue, and it can tighten the muscles of the abdominal wall. But it's not for weight loss. And in general, when we do an abdominoplasty, even when we remove a whole lot of excess skin, it only turns out to be 1 pound or 2 in the vast majority of patients. It's important also that for the best outcome, that when we do the procedure on patients, that they're at a stable and healthy body weight. You don't want to have an abdominoplasty and then gain weight or lose weight, because we want to get you just the right amount of tightness and get rid of just the right amount of skin. So so that's the purpose of the abdominoplasty. So you want to do it at a stable state. Obviously, if you're considering a future pregnancy, it's really not a good idea to have an abdominoplasty ahead of time. I mean, does it happen sometimes that people become pregnant? It happens. Nothing is going to happen to the baby or to your, to anything. There's nothing unhealthy that would happen, but certainly it would destroy the results of the surgery, making it a waste of time and energy and effort. A tummy tuck doesn't change the quality of the skin, but often people have a problem with stretch marks or stria. They're usually in the lower abdomen, and in the vast majority of patients, most of those are removed as part of the procedure. So it doesn't change the skin, but often the way the procedure is performed, which I'll show you in a minute, does remove kind of the most injured skin. So who's a candidate? Really, the people who are good candidates are physically healthy, they're at a stable weight, they're happy where they are from a kind of physical fitness and weight standpoint. We really try hard not to operate on smokers when at all possible because of the higher risks of having wound healing problems and unfavorable results. This operation is specifically designed to change the appearance and contour of the abdomen. It doesn't do anything else. Often when we're doing a consultation, someone will ask, how is this going to affect me up here, or what's it going to do to my back? It doesn't do anything except it restores the contour of the abdominal wall. So the things that I want to know when I first meet somebody who's considering abdominoplasty are really what are your goals? What are you looking to achieve with this procedure? Are there any medical problems that I should be concerned about? Are you in treatment with any medications? Are you a smoker? Are you planning any further weight loss? And have you ever had any prior abdominal surgeries? Sometimes, depending upon scarring, that can change how the operation is performed. If someone's had a gallbladder out or an appendectomy or C-section, those are things that we need to know about when considering a surgical plan. And obviously we want to make sure that you're healthy, that you're not just physically healthy, but mentally healthy, that you're in a good place to be able to tackle an operation like this, that you have a good support system in place, that you can have somebody help you out after surgery. We always take photographs before surgery. Part of that is for me in the planning of the surgery, but also for reviewing the planned procedure with patients. If I show you what it's going to look like for you, that's much more beneficial than you looking at other patients. Not everyone who comes in for an abdominoplasty consult needs an abdominoplasty. Some people may benefit simply from some liposuction or from some skin tightening with a ThermiTight or cool sculpting. It really depends what the goals are and then what we're seeing on physical exam when you come in for consultation. After we review, then obviously we're going to give you your options for treatment, and my job really is to make sure that I give you a good, realistic outcome, idea of an outcome that you may achieve with your surgery. These are the questions that you really should ask anybody that you're considering having surgery with. And the first one is are you certified by the American Board of Plastic Surgery? Anyone who's been reading the news lately, and there's often cases of crazy things happening to patients, and they were operated on by a cosmetic surgeon, and we don't really know what that means and what kind of training they've had. So you want to make sure that you're really being seen by a board certified plastic surgeon. You want to make sure that they had training in plastic surgery. You can ask how many years have you had in plastic surgery? I've had 6 years of training after I graduated from medical school. I'm privileged at Mercy Hospital as well as Midcoast Hospital. You want to know if the place where you're going to have your procedure is certified. Do they have board certified anesthesiologists there? Who's providing the anesthesia? These are questions that you want to make sure you ask to know that it's a safe place to have surgery. One of the good questions, what's expected of a patient to get the best results? The postoperative care for any surgery is a really important part of the overall outcome. Especially with an abdominoplasty, there has to be a period of rest after surgery. The first week or two, you can walk as much as you want to walk, but there's no heavy lifting. You can't do any running, anything high impact, and you really need someone else around to help you do kind of the heavy lifting of life. And that commitment to taking care of yourself in the best way possible and over the time of recovery really lends itself to the best possible outcomes. The surgical techniques are different for everybody depending upon their personal goals, their personal anatomy, their contour, and what procedures or medical problems they may have. Complications, nobody likes to talk about complications. Luckily, the risks are small. I'll go through the specific ones later. We obviously will take care of anything that we can take care of as soon as possible. Most of you know that our answering service is me, that if you dial our phone number at any time, you can dial #7 and get connected to me directly. So I would be the person who's taking care of you. In the rare occasion that I go out of town, which I don't ever do after I operate, there is another plastic surgeon covering. In general, I'm around always after a procedure. So these are the questions that we'd recommend you ask if you're considering abdominoplasty. The anesthesia risks are very low. Over the last decade, anesthesia has become more and more safe. Where we perform surgery at Mercy, there are board-certified anesthesiologists, and there are CRNAs on the team as well. Sometimes we can even use what we call modified anesthesia care. You don't have to have general anesthesia if that's a concern. The risk of bleeding after a tummy tuck is less than 2%. Chances of infection is less than 1%. The most common complication from the surgery is getting a fluid collection, which happens about 10 to 15% of the time. And I'll show you where that happens in just a minute. Occasionally there can be wound healing problems, but in general, and people who are healthy and fit and eating well and taking care of themselves, this is pretty uncommon. Skin loss is also very uncommon, much less than 1% of the time. Numbness does happen, and again, on a following photo, I'll show you where some of the numbness can be. The rest of these things are pretty uncommon. So let's get to how the procedure actually works. Once we decide you're going to have the surgery, we set you up with a consult with anesthesia to make sure that we're going to provide you with the proper levels of comfort for you. But the goal basically for most people is to get rid of all of this tissue between the belly button and the pubic bone. And kind of the shape and contour of this line is really different from person to person. I mean, this is just one example of female anatomy, and most people don't look exactly like this. We're all incredibly variable. But in general, the incision goes as long as it needs to go to get rid of any of the excess skin. In some people, the excess skin may stop right here, so they may have a shorter incision. On some people, the excess skin may go all the way around to kind of the side and the back, in which case this incision is longer. In order for me to get rid of excess skin, I can only do that with that incision. So that's what may change the variability of the length of the incision, really anywhere kind of from here to all the way back here. And then usually the top incision is somewhere around here. This skin and the subcutaneous tissue under the skin is completely removed. So when this is removed, this is kind of what we're looking at underneath is the musculature here. But that's not where the operation ends. The operation actually goes all the way up to the rib cage. This is where the rib cage ends on both sides. We call this the xiphoid, the center part of the chest. And you can see these muscles with inscriptions. These are the rectus muscles. The rectus abdominis muscle goes from your rib cage to your pubic bone, and it's the muscle that gives you like a straight up and down, when you do a sit-up or a boat pose in yoga. These are the muscles that you're using for that head to toe kind of abdominal work. In addition to addressing the skin and the soft tissue, we're also addressing this musculature. This space right here between the two rectus muscles, in some cases, is actually quite wide. It can be even all the way out here in some people, and that is an area that gets stretched out with weight changes. So if someone has, had a bout with a lot of weight gain and then losing weight, sometimes this gets stretched out and it doesn't come back. It's most common with pregnancy. The interesting thing about the abdominal anatomy is there are people who, they've had 3 10-pound babies and they have no space here and they have very little extra skin. And then there's some people who have one 6-pound baby and they have a ton of extra skin and a ton of laxity in the abdominal wall. And a lot of that is just genetics and individual anatomy. So how we know what's under here is by a physical exam in the office. I can tell the distance of this space based on my physical exam to know how much work needs to be done to tighten up the abdominal wall. And to go back to what I said at the beginning, that's why I think this is one of my favorite operations, because if people have a wide gap between those muscles here, when they try to do a sit-up, kind of their belly comes up and through that space, and people just don't feel strong. It's hard to work on your core muscle strength, and the core muscles are supporting your lower back and most of your movements. If this is weak, it's very difficult to strengthen because you lose that straight line muscle contraction. So getting the muscles back to midline really helps strengthen that abdominal wall. The other muscles involved in kind of your core strength are the obliques and the transverse muscles, which are both underneath those rectus muscles. This is probably more than anyone wants to know, but I feel like this is the kind of the most interesting part about recreating kind of that strength of the abdominal wall. So people really can get their muscles back to strong once we get these muscles back to midline. So that's why the operation comes up so high, is because we want to be able to address this contour. And you can see in this image here that this is called fascia. There's a connective tissue overlying the muscles, and that's what's sutured together kind of from top to bottom, cinching in the waist and pulling those muscles to the midline. This is the part actually that's the most uncomfortable postoperatively. If it's just a skin excision, yes, the incision is uncomfortable, but this is kind of feels like you've done 1,000 sit-ups. There's a kind of a deep achiness pulling these muscles together, but you can see no muscles are injured, no muscles are cut. It's just tightening kind of the corset of the abdominal wall. So that's kind of the key, one of the key components of an abdominoplasty procedure is getting that nice and tight. And the second part is just contouring the skin and soft tissue to make sure that there's a nice flow from the upper abdomen to the lower abdomen. And again, some people have more excess above, some people have more excess below, and the operation is designed around what you need to get the contour that you're looking for. Once this edge up here is pulled down here to close, we make a new hole around your belly button. So your belly button, there's an incision that goes around it. It stays right where it is. It's still your belly button in your position. I have some ability to move it higher or lower depending upon where it's positioned, but in general, it's in the right place to start, and we bring it out through an incision in the abdominal wall. So when it's all closed up, there's one incision here and a small incision here. Very occasionally, if someone has had a lot of abdominal surgery and they don't have a normal belly button, then we can recreate a belly button in that area. The incisions are always closed with absorbable sutures, and nothing needs to be removed from the incisions themselves. And you can get a pretty good idea of your contour even the day of surgery, the day after surgery. You can, even with some swelling, you get a good idea of what things are going to look like. So that's the basics of it. This is just to tell you a little bit about what the recovery looks like. And there are some handouts that are available to you that you can see related to pre-op instructions and post-op instructions that we give our patients undergoing abdominoplasty. But in general, when a patient leaves the operating room, their incisions are covered. There's some dry dressings over the incisions. We use an abdominal binder, which is kind of just like a spandex tube that goes around your belly, put some compression on that area. I do use drains in the vast majority of patients. It's just people call all the time asking if I can do a drainless abdominoplasty. I went from using drains to not using drains, and I'm back to using drains. So it can be done without the drains. In my experience, people do really well with the drains. In most cases, they're out before too long. They are annoying while they're there, but it's a short-lived thing, and I think the risk of having any fluid collection is really worth placing those drains. Usually they came out about 5 days post-operatively. And we obviously teach you how to take care of the drains. So our job is to make sure you're well educated on watching your surgical site to make sure that it looks healthy, any medications that we use to make people comfortable. Most of you probably know there's been a huge opioid crisis in our state and our country, and we've all done a lot of work to try to figure out how to make patients more comfortable with less narcotics. So we have medications that we actually start the night before surgery. There's one medication and another one that we add the morning of surgery that you'll take for 4 or 5 days during the recovery, and that greatly reduces what you need for narcotic pain medication. Many patients take maybe a dose or 2 of narcotics the day of surgery and the day after, and that's about it. We're pretty good at making you comfortable after surgery. And then we want you to know that what we feel like where we really excel is that we're here for you. If you have any concerns, we want you to call us, and we want you to know that we're going to help you out with that. The surgeries currently we're doing them at Mercy. You're able to go home the same day. We do request that you have somebody stay with you at least that first night. Ideally, someone would be with you the first 48 hours. Mostly there's kind of a haze that people go through when they've had general anesthesia, and it's not that you can't hold a conversation, but you might not remember when you take your medicines, things like that. So it's good to have someone who can help you out with managing medications, and just someone who can watch you that first day or 2 while you're a little bit groggy. The drains usually are out in the first week, and there's no sutures that need to be removed. They're all absorbable on the inside. The thing that people find the most irritating about drains is that you can't take a shower until the drains are out. So it's a sponge bath until that drain comes out. As far as compression garments, the garment that we give you, the abdominal binder, most people wear that for the first week or 2, and then after that you can wear any compression garment that's comfortable for you. The market of Spanx was kind of the originator of the abdominal compression, but almost any department store has a pretty good section of those kinds of garments, and anything that makes you feel supported during your recovery is fine to wear. And we'd like you to wear that for the first 4 to 6 weeks. I see you regularly post-operatively, so I can monitor how the swelling's going and how much compression you need. So we can alter that as needed. But in general, it's 4 to 6 weeks. As far as activity and exercise, I would love it if everybody started walking day 1. You can't walk too much. You can do stairs, that's all fine. The more you're moving, the better. The less likely you are to have a complication of a blood clot, also known as DVT. The other thing that can happen when people aren't mobile, if you're kind of stiff and protecting your belly, then you can get neck pain and back pain and shoulder pain from kind of splinting. So it's really great to be able to get up and start moving the day of surgery, and that's another reason to have somebody else, kind of to have like a fan club around, so that's supporting you through this. They're getting you up, they're making you walk, and keeping you moving even when you don't feel like it, because you'll feel so much better, so much more quickly if you stay mobile. As far as normal activity, normal social activity can be resumed in usually 5 to 7 days. A lot of people, if they have a sedentary job or a desk job, they can get back to work in a week. But anyone who is doing any kind of physical labor, if it's, people who if you have to move patients or boxes or anything heavy, then that really can't be resumed for 6 weeks. And the reason mostly is for that repair of that abdominal wall, that it's not a hernia repair, but in a way, we really need that to be knit together to keep things strong and stable, and that doesn't happen for 6 weeks. So from an exercise standpoint, you can be, walking and mobile, but not running, not jumping, and no heavy lifting for 6 weeks. As far as follow-up care, we see each other often in the first week or 2 while we're monitoring drains in the incision, and kind of less and less over time as we know that you're doing well, and then usually a 3-month, a 6-month, and then a 1-year follow-up. As far as what you can expect, Initially, there is some swelling and things will feel pretty tight, but usually within the first week, people are able to stand up perfectly straight. It could be at least 8 weeks before you want to lay on your back with your arms overhead, because you can imagine that would put a lot of tension on the scar, but kind of general mobility will be fine in a week or two. And then as far as what it's going to look like, one of my favorite things about our office here is that every room has a full-length mirror on the back of a door. So when we do the consultation, I'm looking at what you're looking at. We're looking together in the mirror, and I'm able to show you exactly what I can remove and what I expect your contour to look like. The scars, the location is similar to the location of a C-section scar, and if there is a C-section scar, the new scar goes right underneath that to get rid of the old scar tissue from that procedure. Scars, I would say, are the kind of the least predictable thing from person to person. In general, they're very favorable. They heal to a white line over time. It's something that's very obvious in the first 3 to 4 months, and then by 6 months they're lighter, and by a year and 6 months they're pretty light. Scar management with massage and other topicals can be required from time to time if someone seems to be scarring in a little bit more of a prominent way. We do have the ability to treat people with lasers if the scars are redder than we'd expect, and sometimes with steroids if they're thicker than we expect. So we watch the scars, how they develop over time, to make sure that we're taking care of you in the best possible way. These are examples. We tried to pick people of all different sorts of shape and sizes. I mean, this person you can see is concerned about the excess skin above and below her belly. On her, we did a midline incision because of the amount of excess. And it's not necessary on anybody, but if there's a whole lot of extra skin, it's just a way to make things smoother and improve the contour. And you can see at 6 weeks, the scars are pretty red and pretty obvious. But that's what it looks like 6 weeks after surgery. So at this point, she can get back to her normal activity. It's certainly not her end result. We expect that over the next 6 months, things will get softer for her. This is another person who had major weight loss and a lot of extra skin. And you can see the laxity of her skin and the number of stretch marks that she has throughout the whole area. So it doesn't get rid of the stretch marks, but it gets rid of the extra skin. And you can see the difference at 2 months. It still looks red and pretty prominent, and then at 3 months it's lighter, and at 6 months it's going to be even lighter. So it's a dramatic change in contour and kind of the tightness of her abdominal wall. These are 2 photos of what I would say are more kind of like a typical average abdominoplasty patient, kind of a normal postpartum deformity with skin excess. You can see that there's laxity in the skin both above and below the belly button. In some occasions, we can just make an incision, a smaller incision, and deal with skin excess down here. But in the vast majority of patients, the excess continues above the belly. On both of these patients, you can see there's extra skin above the belly. So if we don't make that incision around the belly button and take the surgery all the way up to here, I can't bring this down to flatten out the upper portion of the abdomen. So the incision, you can see on this patient, this tattoo that was originally all the way up here, the bottom of the tattoo is now, right above her incision. So all of the skin gets smoothed down and pulled down and tightened. She's nice and smooth, both above the belly button. We've gotten rid of this excess skin. And it's, she's just smooth from top to bottom. On her, the incision comes to here because you can see where that fold over is. On this patient, it's a little bit longer to get to a smooth contour on the edges of a body. And everybody's shape is different. Kind of what we're looking for as far as the final result really depends on the skin quality, the skin tone, the amount of excess soft tissue. But on most people, it ends up being an incision basically from hip to hip with some extension depending upon the amount of soft tissue excess. So we're addressing both the kind of the inner strength and contour. You can almost see here how she has, you can see her midline now that the excess skin has been removed. And you can almost imagine the contour of her muscles that are now back together in the midline. And that's what the pictures look like. This is just to show you again This is the person who had a appendectomy scar, and you can see the scar is kind of tethering the soft tissue. So she has a little kind of shelf above it. It's a common thing that we see with people who've had cesarean sections. There's kind of an overhang of soft tissue over top of that scar because of the tethering. So these are often the happiest patients because it's changing the contour of that overhang and getting rid of that scar tissue where it feels tight. And her, again, we came all the way up here to make sure that we could get rid of this skin excess and create a nice smooth contour from top to bottom. This is a very fresh, 6-week-old abdominoplasty. So that's what it looks like at 6 weeks. At 6 to 8 weeks is when scars are the reddest and the most obvious. And from there, they get softer and lighter and whiter over time. So we'd expect, in another 6 months, this would be a nice faded, light colored line. And now I have time for questions. If there are any, let me see if I can pull up the questions. So here we go. Someone asked the question, I have heard that there is difficulty standing up straight for a while. Do you know how long that typically lasts, and is this common? So there's definitely tightness of the lower abdomen after abdominoplasty. Typically, people really aren't walking bent over. The goal is to have you be able to stand up reasonably straight. By a week or 2 weeks, you should be able to stand up completely straight. It could be, 6 weeks before you want to lay flat on your back. And then things I always think, because of yoga and other physical activities, that it's going to probably be more like 8 to 12 weeks before you're going to put your arms over your head and, do some major leaning back and stretching that scar. There's really no risk of injuring the scar in any way. It just feels tight, and that tightness, it can last quite a while. The goal for me is to make sure that I make it tight enough that I get rid of everything you want to get rid of, but not too tight so that it's uncomfortable to stand up straight. So that's really not a problem for most people. We get them moving pretty quickly. And let's see if I can see the next question. Is liposuction, hold on one second, I gotta change my view here. Let's see. Is liposuction necessary when getting a tummy tuck to get the best results? That's a great question. Liposuction, I would say, is not necessary for a lot of people. It really depends how much soft tissue is there. If there's sometimes like just a little bit of excess in a focal area, liposuction can be very beneficial. Oftentimes it's actually the area lateral to the liposuction, so the flanks can sometimes be an area that can really benefit from liposuction in conjunction with an abdominoplasty. If someone has a very thick abdominal wall or some irregularities, then liposuction can be used in conjunction. There's a trade-off between taking enough skin and making that tight and removing the fat. So it's a balance between doing a little bit of both to get the right contour. But I would say, not even 25% of people need liposuction at the time of abdominoplasty. It really depends upon their anatomy. And again, it's the area surrounding the abdominoplasty, not the belly itself, that needs the most liposuction. Any other questions I can answer? I just see tightness and liposuction, unless I'm missing something. My window is small. Let's see. What else can I tell you? As far as timing, one of the questions that I've been asked is if somebody has something like a major weight loss or pregnancy, how long do you wait before you can have an abdominoplasty? From a major weight loss, it's important to have your weight stable for 6 months prior to surgery. And mostly we want to give you the best possible result. And if you're at a stable weight that's working for you, then I can make sure that I'm going to get rid of just the right amount and not too much, and that it's going to be a stable and long-lasting good result. So stability for 6 months in the case of a significant weight change. From pregnancy, I think a year, and longer still if someone's still breastfeeding. I think a year past, past pregnancy, past the delivery date, and at least 6 months after somebody has stopped breastfeeding. And that's because there's so many changes that happen in the abdominal wall, and the amount of fatty tissue that stays on board while you're breastfeeding. We want to make sure, again, the goal is to do the operation when someone's at a steady state, a place where they're comfortable and happy and they plan on living. We all fluctuate, 5, 10, 15 pounds, that's not a concern. But if it's more than that, it really can change your result and your long-term outcome. So for the best possible durable outcome, stability in weight is super helpful. I think that's it. I don't see it. Oh, here's another question. Let's see. Are there certain, for individuals that want to get more than one procedure, are there certain types of surgery that you will not combine with a tummy tuck? I considered a tummy tuck and an arm tuck and was advised that they could be incredibly uncomfortable if performed together. I mean, for sure, having your arms and belly done at the same time, is it uncomfortable? Yes. Is it twice as uncomfortable as having one operation? Definitely not. How I look at combining procedures, in most cases, it's beneficial because you're going to have one downtime, and it's really you're going to be having a similar pain regimen anyway. So I think that a lot of procedures can be performed together. I think. I think doing like an arm lift and a tummy tuck and a thigh lift, would I do all that at once? Probably not. But things that are in the general area, like breasts and arms together, or breasts and belly together, I think can work quite well. Just breasts and thighs, yes. I think more than 2 or 3 operations is really just too much. And mostly that's related to time on the table in the operating room. That anything that's under 6 hours is safe, and after that amount of time, we worry more about someone having complications. So that's the main reason not to perform too many surgeries. But I think in general, it's safe and can be very beneficial to have more than one operation at the same time, because who has downtime between work and family and everything else. So I would say that's not a reason not to have. I'm just trying to see if I can get a better look at these questions. There's a question about C-section scars. Can I still get a tummy tuck with a vertical C-section incisions? And yeah, so I think one of the pictures I showed earlier, I'm going to go back to this slide. Some people may have an incision that goes up and down on the abdomen. So instead of, the C-section down here, it might be an up and down scar for a C-section. And because this is the area that we're getting rid of, that's not a problem for doing this operation. So that scar doesn't limit. One of the only thing that really can limit what can or can't be done from a scarring standpoint is the way that that general surgery we used to do. Gallbladders was an incision that went right under the ribs up here. Currently, more than 90% of gallbladders that are done laparoscopically, and those little incisions don't affect what we can or can't do with an abdominoplasty. But if there is a large subcostal scar right here, that can limit how much skin can be removed in this up and down direction. But any scars that are in the lower abdomen or midline really don't affect what we can change for contour. And for that subcostal scar, it's really related to the blood supply. If the incision has been made up here, we don't want to decrease the blood supply to the skin. So that's it. Also depends upon the timing, how long ago was that procedure, and what the rest of the abdominal wall looks like. But the vertical scar is not a problem. Let's see if I can see anything else. I think that's all I see. I don't see anything else. Do you, Ashley? If you do have questions, please, we definitely welcome you in for a consultation. You can tell that you can probably tell this is one of my favorite topics. I'd love to answer your questions in person and help you go over your goals and where we could, what we could help you achieve with an abdominoplasty or another procedure for abdominal contour. And thank you very much for joining us this evening, and we look forward to seeing you for our next webinar. Have a good night.